Turning now to the latest on mental health in our state's young people. A new state law now requires schools to print numbers to mental health resources on the back of student IDs. All school-issued IDs for middle schoolers and up, including higher education, must have the number to the National Suicide Prevention Hotline on it. This comes as new data shows an increasing number of students in our state are struggling with poor mental health. Well, we know that heading back into the classroom can be a challenge for some, so we have brought in Dr. Peter Loper with Prisma Health to talk with us about how to best deal with back-to-school stress and anxiety. Dr. Loper, thank you so much for waking up just a little bit earlier to join us this morning.
My pleasure.
All right, so my first question really has to do with what you spoke about earlier in the show, and you talked about the signs and symptoms of depression or anxiety in teens or children. And I know that this can be a sensitive topic, but what if a child or a teen goes to their parent or guardian and says, hey, I'm struggling right now with my mental health? How can they best navigate this situation?
Yeah, so that's when it's time for the parents to seek immediate support and resources. The best place to start is always with your primary care doctor. Your primary care doctor kind of can serve as the quarterback. They can direct you and call the play that is required to give you your child the support they need. And then the other thing that you can do as a parent is stay engaged and consistently check in. Continue to engage with the child and make sure that you're intentional in having that open line of communication.
All right, let's talk about a pep talk. I know that many of the kids are going to be going back tomorrow, Monday, and then Wednesday is the big day that everybody goes back. What sort of a pep talk should we be giving them before they head off to school to put them in the right mindset to just, take on the day and be confident?
Boy, that's a great question. I don't know if I'm the best person to answer that necessarily, because I've tried some pep talks with my kids. They haven't gone that great. But that being said, I will say that the reality is that if you have a child who in the past has had some anxiety with going back to school, there's certainly some things that you can do to help mitigate that or help blunt that anxiety a little bit. And one of the best things you can do now is if your child's not already back in school, go ahead and start the school routine early. Get them on the right sleep schedule, get them up in the morning around the same time you would for their school. And if your child has really severe anxiety and has exhibited school avoidance behaviors in the past, one of the best things you can do before the school year starts is to go ahead and do some practice runs. Get them up, get them dressed, get them in the car, drive them to the school as though you would be going to the school on a regular school day. So in a few days, when they're actually back in the routine, it's not as shocking and it's not as jarring for them.
All right, and Dr. Loper, I have a question for you too as well. What happens, we're into the school year, we're into the school day, and something triggers us or something happens. Do you have any coping mechanisms for young people that they can do in the midst of the school day while they're there to help them cope with whatever they're going through?
Sure. I would say the first thing to do if your child has one of those experiences in the middle of the day is make sure that the system in the school setting is conducive to support them. So make sure that they are comfortable going to their teacher. If they're older kids, they're adolescents, make sure they have a good peer group that they can go to and seek contact with and seek support from. And then things that kids can do individually, by themselves if they start to have that anxiety creep up. Deep breathing exercises are always really, really helpful. They can even do what's called progressive muscle relaxation, where they squeeze their fists really hard and then gently relax, squeeze their toes really hard and gently relax. These are some things they can do real time in the moment if they start to have that anxiety. But again, the biggest resilience factor is going to be those meaningful interpersonal interactions. So if they start to have anxiety, educate your children to seek support from teachers, friends, or counselors or administrators.
Now, Dr. Loper, we have a question from a viewer that we want to bring you this morning. So this is Carrie from Pillion. She says, my grandson was bullied last year. He's 11 years old and he was even jumped by other kids. It was addressed by parents, school, and counseling. He absolutely does not want to go back to school. So when it comes to bullying, how can they best handle this?
Well, first of all, let me just acknowledge how difficult that situation's got to be. And it's something that we see all too often these days. Bullying is really tough. It's not just the bullying these days. Bullying has been around for a number of years. I know that I experienced bullying when I was a kid. The reality, though, is that bullying in this day and age, where kids are so much more isolated, we were in the middle of the isolation epidemic before COVID started, bullying is that much more difficult to navigate because kids are so much more fundamentally isolated. And that avoidance behavior is going to thrive in the context of isolation. If that child doesn't feel psychologically safe to go to school, that's going to be a big deterrent. The reality is that the best you can do is seek the support from the school administrators to make sure that those limits are set, to make sure that those bullies are held accountable for their behavior if they should choose to engage with the child. The other thing too that I would mention about the idea of bullying or any other kind of trigger at school that's promoting school avoidance behavior, the more that you allow your child to avoid going to school, the more it empowers that anxiety, the more it empowers the bullying. So those are some things that I would really emphasize to parents.
Dr. Loper, thank you so much for joining us this morning. Everything that you have told us is going to be so useful when it's time to get those kids back into the classroom. So again, thank you for joining us for News 19 this morning. We truly appreciate you. And as a reminder, friends, if you or someone you know is in crisis, the National Suicide Prevention Lifeline can connect you to resources. As of last month, the new 3-digit number is up and running. Just call or text 988 and you'll be connected to a mental health professional. And y'all remember, there is never, ever any shame in getting help.